Acupuncture, allied therapies. Dedication. We dedicate this video to all the humanity which believe and follow the path of natural philosophies of acupuncture to endure healthy and peaceful life. Thanks. We sincerely thank all those who have contributed their knowledge, time and hard work to succeed in our endeavor to bring out this video for serving humanity to given an ultimate knowledge of the life and acupuncture. Jok, invented by Professor Park Jo-woo, an eminent Korean philosopher and scientist. Jok therapy is a new approach to treatment. Jok therapy, a part of Onuri medicine, is a system of treatment comprising of a variety of techniques to prevent and cure illness and restore health without any drugs. The theoretical basis of this system of healing is the discovery of self-regulation, homo-energy system of human body, whereby each hand and foot and other locations of human body carries information of each parts, organs of human body. The hands and feet structurally being the most similar parts to the human body. These corresponding micro points areas can therefore be used most conveniently and effectively as remote controls to treat an diseased organ or part in the human body. In Korean language, Su means hand, Jok means food. The theoretical basis of this system of healing is the discovery in each hand and foot, shape and points corresponding to each part, organ of human body. These corresponding micropoints systems in hands and feet can therefore be used conveniently and effectively as remote controls to treat any diseased organ or part in human body. Jok acupuncture is a multi-dimensional healing system. The first dimension is a physical healing system, whereby giving simple stimulation to the specific corresponding points in hands and feet, cure is achieved. It is possible as hand as a miniature correspondence treatment system is the most symmetric part of the human body in structural shapes among entire corresponding systems. On the other hand, the most potent and effective miniature body correspondence system is found in the foot. This type of therapy is very popular due to its ease to learn, safety, efficacy, and pace of healing response is often dramatically fast. It contains no forbidden or dangerous practices. Therefore, it can be practiced by paramedics and laymen for self and others treatment. The second dimension treatment is adapted from classical acupuncture. The classical 12 meridians, the 8 extra meridians and their attendant points are represented on the hands and feet in vial meridians and vial points. Philosophy-Correspondence system. The human body is a complex mechanism where all parts work in constant close interrelation. To function correctly, they continuously interchange information. In every part of the body, without interruption, comes in information about all other parts, and at the same time information about each part's condition is emitted. This interchange of information as well as the storage of the received information is carried out by the so-called correspondence systems. The correspondence systems are informative, power-producing projections of the organism located on all independent parts of the body. They look like reduced images of the human body, so deformed that to build in the form of the appropriate body part. Correspondence systems are built in the ears, head, feet, hands, internal organs, tongue, eyebrows, and all other parts of the body, even in each cell. Since each correspondence system is a reduced image of the organism, all the organs, all parts of the body are represented in it. The zones or the areas of the correspondence systems which correspond to the particular body organs are called correspondence zones. Each organ and part of the body has their own correspondence zone in all correspondence systems. For example, the stomach has a zone of correspondence in the system of correspondence located on the ears, eyes, feet, and in all other correspondence systems. The correspondence systems are in continuous information interchange. They contain full information about the organism, about its present condition, save for the fact that they have information about the human organism. They actively stimulate its state of health. The mechanism for this stimulation is the following. When an organ gets diseased, in all other correspondence systems, a signal concerning this is received. The correspondence systems react as one or more miniature spherical formations in the correspondence zone. Tissues of the diseased organ are formed in them. When pressed, they are painful and they are subjectively felt as pain points. Further, we will refer to them in the same way. If the kidney gets diseased, pain points appear in its correspondence zones located on the ears, hands, feet, tongue, nose, fingers, and all other independent parts of the body. The same happens with a disease of the stomach, eyes, liver, and every other organ or part of the body. In everyday life, man continuously stimulates accidentally and choitically one or another correspondence system, and the pain points that have appeared, they are a result of disease. When you put a hat, you press part of the correspondence zones. Like this way, we stimulate our points and the healing process happens. But due to the sedentary habits and more chronic disease, accidental healing will not happen. This needs a more powerful healing system. The correspondence systems located on independent parts which have the strongest resemblance to the human body and create healing impulse most often. Such independent parts are the hands and the feet. They have an amazing structural resemblance, a similarity to the human body structure. In addition, they get most often into contact with the environment, thus creating healing impulses most often. Nature wisely took care of things, and the most often created impulses are the most powerful and effective ones. Because of that, the healing impulses generated in the correspondence systems located on the hands and feet are far more powerful and effective than the impulses generated in the most of the other correspondence systems. The Jok therapy has entirely been created on the basis of the correspondence systems located on the hands and feet. It consists of two levels. The first level is easy to use by people without medical education and includes several healing correspondence systems. From practical point of view, the most important two of them. Main correspondence system, insect correspondence system. Main correspondence system. The hands and feet structure is almost identical with the structure of the human body. Forming a mental image, it is sufficient to turn your thumbs up with their adjoining areas of the palm to see that the similarity to the human body is amazing, and the correspondence zones of the organs and parts of the body appear clearly and logically. The thumb corresponds to the neck and head. The second and fifth fingers correspond to the upper limbs. The third and fourth fingers to the lower limbs. The knuckles correspond exactly to the joints of the limbs. The palm, the foot and their backs to the torso. The correspondence zones of the internal organs are located on the palm and foot, following the resemblance principle. In this way, on each hand and foot of a correspondence system of the human body is formed, called main correspondence system. Insect correspondence system. The fingers and toes are independent parts of the body as well as the entire hands and feet. On each independent body part and hence on each finger and toe a healing correspondence system, similar and corresponding to the human body is located. Each organ or part of the body has its own correspondence zone in the correspondence system of each finger or toe. With a disease in the correspondence zones of the diseased organ, pain points appear on each finger and toe appear pain points. The stimulation of these points has the same healing effect as the stimulation of the pain points in the main correspondence systems. The insect bodies consist of three parts: head, chest, stomach. In the same way, the correspondence systems on the fingers and toes are located. On the distal first phalanx of the fingers and toes, the head and neck are projected. On the middle second phalanx, the breast cell is projected. On the proximal third phalanx, the stomach area is projected. Because of that, the system is called insect correspondence system. The upper limbs are projected in bent position in the side part of the middle phalanx of the fingers and toes. The lower limbs are projected in bent position in the side part of the third phalanx. Right and left half. The body has two vertical halves, left and right. In the same way, each correspondence system has left and right half, corresponding with the left and right body half. The position of the left and right half in the main correspondence system is defined when your own hands, feet are with fingers, toes directed downwards. The palms, feet are turned forward. Form a mental picture of the turned up thumb together with its adjoining area of the palm or foot as it is on the right halves of the hands, feet. the right body half is projected and on the left half the left body half. The position of the left and right half in the insect correspondence system is defined when your own hands, feet are with fingers directed upwards. The palms are turned forward as it is in the right halves of the fingers, toes. The right body half is projected and in the left halves, the left body half. In the both systems, all organs have correspondence zones on the left hand as well as on the right hand. The correspondence zones which are on the side of the organ they represent are called primary zones and these on the other side secondary. Example: the liver, gall, right leg, right arm, right eye, right ear, etc. are organs located in the right body half. That is why their primary correspondence zones are on the right hand, foot, and their secondary correspondence zones are on the other side on the left hand. Acupuncture, allied therapies. Example: the heart, spleen, left leg, left arm, left ear, left eye, etc. are in the left body half. That is why their primary correspondence zones are on the left hand and their secondary correspondence zones on the right hand, feet. The primary correspondence zones are closer to the organ they correspond with and maybe that is the reason for their greater effectiveness. They have priority when you choose a zone for stimulation. Example: the liver, gall, right leg, right arm, right eye, right ear, etc. are organs located in the right body half. That is why their primary correspondence zones are on the right hand and their secondary correspondence zones are on the other side on the left hand. Example: the heart, spleen, left leg, left arm, left ear, left eye, etc. are in the left body half. That is why their primary correspondence zones are on the left hand and their secondary correspondence zones on the right hand. The primary correspondence zones are closer to the organ they correspond with and maybe that is the reason for their greater effectiveness. They have priority when you choose a zone for stimulation. Diagnosis: before choosing the exact zone or point in Jok, we would be clear in diagnosis. The diagnosis can be made by any methods which we discussed in earlier videos like pulse diagnosis or other methods as in acupuncture. Treatment: the treatment stimulation can be in any methods: touch, moxa stimulation, cold stimulation, Jok needles, management, magnet stimulation, various massage techniques. Biol meridians or Jok meridians, same as body meridians and body acupuncture points. The hands will have its own meridians and points. As we know, the hands have its own correspondence to the body. Auricular therapy. Auricular therapy is a healthcare modality in which the external surface of the ear or auricle is stimulated to alleviate pathological conditions in other parts of the body. While originally based upon the ancient Chinese practice of acupuncture, the somatotypic correspondence of specific parts of the body to specific parts of the ear was first developed in modern France. It is this integrated system of Chinese and Western practices of auriculotherapy that it is described in this video. Not only in acupuncture but also some other healthcare practitioners also use this auricular therapy. Those are dentists, chiropractic practitioners, biofeedback therapists, medical doctors, naturopathic doctors, nurses, osteopathic doctors, physical therapists, psychotherapists, reflexologists, but most of them use this for pain management and stress relief. History of auricular therapy. China. All recorded systems of classical acupuncture are attributed to the Chinese medical text. The Yellow Embraces Classic of Internal Medicine with 1972, compiled between 206 BCE and 220 CE. In this video, all 6 young meridians were said to be directly connected to the auricle. Only the young meridian channels travel or to from the head, whereas the 6 in meridians were said to connect to the ear indirectly through their corresponding young meridians. These ancient Chinese ear acupuncture points, however, were not arranged in an anatomically organized pattern. They were depicted on the ear as scattered array of non-meridian points with no apparent logical order. Reactive ear acupoints that were tender to palpation were referred to as young alarm points. Other spotted auricular therapy practices are the Egyptologist Alexander Varil has documented that women in ancient Egypt who did not want any more children sometimes had their external ear prickled with a needle or cauterized with heat. Gold earrings worn by Mediterranean sailors were not just used as a decorations but were said to improve vision. Cauterization were done by ancient Persia, Europe and Middle Ages for the treatment of CTS pain. In 1957, Dr. Paul Nogier, a physician residing in Lyons, France, first presented his observations of the somatotypic correspondence of the auricle. Father of auriculotherapy, Dr. Nogier originated the concept of an inverted fortress map on the external ear. After Nogier's study and his charts, a massive study was initiated by China again and verified the clinical effectiveness of Dr. Nogier's study. In the 1970s, the Hong Kong physical physician H.L. conducted the first clinical studies on the use of ear acupuncture for opioid detoxification. In United States by 1973, Dr. Michael Smith at Lincoln Hospital in New York led to the application of auricular acupuncture for withdrawing addicts from opiate drugs, crack, cocaine, alcohol and nicotine. International meetings of the WHO sought to standardize the terminology used for auricular acupuncture nomenclature. Dr. Nogius invented Fortis map. In 1950, Nogier 1972 was intrigued by a strange scar which certain patients had in the external ear. He found that the scar was due to a treatment for sciatica involving cauterization of the anti-helix by Mame Berin, a lay practitioner living in Marseille, France. The patients were unanimous in stating that the lad had been successfully relieved of sciatic pain within hours, even minutes of this ear cauterization. Mame Berin had learned of this auricular procedure from her father, who had learned it from a Chinese Mandarin. Nogier stated, I then proceeded to carry out some cauterizations myself, which proved effective. Then tried some other less barbarous processes. A simple dry jab with a needle also led to the relief of sciatica. If given to the same anti-helix area, an area of the ear which was painful to pressure. Nogier discussed his anti-helix cauterization experiences with another physician, Rene Amatia, who told him the problem of sciatica is a problem of the sacro-lumbar hinge. Nogier conjectured that the upper anti-helix area used to throat sciatica could correspond to the lumbosacral joint, and the whole helix could represent the remaining spinal vertebrae, but upside down the head would have its correspondence lower on the auricle. The ear could thus roughly resemble an upside down embryo in utero. Nogier subsequently obtained pain relief for other problems using electrical micro currents imperceptible to the patient. Nogier concluded that the pain relief was not due to nervous reaction to the pain from needle insertion, but was in fact caused by the stimulation of that area of the ear. Anatomy of ear. It is more important to know about the anatomy of ear to know the body representing parts of the ear. Ear canal, audiometus, the funnel-shaped orifice that leads from the external ear to the middle ear, and inner ear is an elliptical oval that separates the inferior concha from the substratus. Helix, this outermost circular ridge on the external ear provides a folded cartilaginous rim around the auricular. It looks like a question mark. Helix root, the initial segment of the helix ascends from the center of the ear up toward the face. Superior helix. The highest section of the helix is shaped like a broad arch. Helix tail. The final region of the helix descends vertically downward along the most peripheral aspect of the ear. Antihelix. This Y-shaped ridge is anterior opposite to the helix ridge and forms an inner concentric hill that surrounds the central conga of the auricle. Superior crest of the antihelix. The upper arm and vertical extension of the antihelix. Inferior crest of the antihelix. The lower arm and horizontal extension of the antihelix. This flat-edged ridge overhangs the superior conga below it. Antihelix body. A broad sloping ridge at the central third of the antihelix. Antihelix tail. A narrow ridge at the inferior third of the antihelix. Tragus. The tragus of the auricle is a vertical trapezoid shaped area joining the car to the face, projecting over the ear canal. Antitragus. This angled ridge is anti or opposite to the tragus that rises above the lowest portion of the inferior conga. It has a distinct groove that separates the antigrass from the antihelix tail. Above it and a less distinct creeve where the antitragus meets the intertragic notch below it. Intertragic notch. This U-shaped curve superior to the medial ear lobe separates the tragus from the antitragus lobe. This soft fleshy tissue is found at the most inferior part of the external ear. Scaphoid fossa. A crescent-shaped shallow valley separating the helix and the antihelix. Fossa refers to a fissure, groove or crevice, whereas scaphoid refers to the scaffolding used to form the outer structure of a boat or building while it is under construction. Acupuncture allied therapies. Triangular fossa, navicular fossa. This triangular groove separates the superior crest and the inferior crest of the antihelix. It is shaped like an arch on the window of a Gothic cathedral. Conga. A shell-shaped valley at the very center of the ear. Conga refers to the conch shell, superior concha, known as the Simba concha in classical anatomical texts. The upper hemiconcha is found immediately below the inferior crest of the antihelix. Inferior concha, formerly known as the vac cavum concha in classical anatomical text. The lower hemiconcha is found immediately peripheral to the ear canal. Concha ridge. This raised ridge divides the superior concha from the inferior concha. It is the anatomical prolongation of the helix root onto the concha floor. Concha wall. The hidden vertical region of the ear rises up from the concha floor to the surrounding antihelix and antitragus. The concha wall adjacent to the Antihelix is a curving vertical surface which rises from the floor on the concha up to the antihelix ridge. The concha wall adjacent to the antitragus is a vertical region underneath the antitragus ridge that leans over the lower inferior concha floor. Subtragus. This underside of the tragus overlies the ear canal. Internal helix. This hidden underside portion of the brim of the helix spirals from the center of the helix to the top of the ear and around to the helix tail. Anatomy of posterior lobe. Posterior lobe. This soft, fleshy region behind the lobe occurs at the bottom of the posterior ear. Posterior groove, a long vertical depression along the whole back of the posterior ear, which lies immediately behind the Y-shaped antihelix ridge on the front side of the auricle. Posterior triangle, the small superior or region on the posterior ear which lies between the two arms of the Y-shaped posterior groove. Posterior concha, the central region of the posterior ear found immediately behind the concha. Posterior periphery, the outer curved region of the posterior ear behind the helix and the scaphoid fossa. It lies peripheral to the posterior groove. In auriculotherapy, an active reflex point is only detected when there is a pathology, pain or dysfunction. Body correspondence to the auricular regions. In the corresponding part of the body, if there is no bodily problem, there is no ear reflex point. An effective reflex point is identified as an area of the ear which exhibits increased sensitivity to applied pressure and increased electrodermal skin conductivity. Helix, anti-inflammatory points and treatment of allergies and neuralgias. Helix root, external genitals, sexual disorders, urogenital dysfunctions, diaphragm, superior helix, allergies, arthritis and anti-inflammatory process. Helix tail, representing the dorsal horn, sensory neurons of the spinal cord and the pre-ganglionic sympathetic nervous system. This region is used for peripheral neuropathies and neuralgia. Antihelix, main trunk and torso of the body, that is a part of musculoskeletal system. Superior crust, lower extremities of leg and foot. Inferior crust, lumbosacral spine, buttocks, scitotia, low back pain. Antihelix body, thoracic spine, chest, abdomen, upper back pain. Antihelix tail, cervical spine, throat muscles, neck pain. Lobe, cerebral cortex, lobes of the brain, sensation of the face, eye, jaw and dental analgesia. The ear lobe represents conditioned reflex, psychological resistance and emotional blocks. Tragus, corpus callosum, appetite control, adrenal gland. Antitragus, skull head, and treatment of frontal, temporal, and occipital headaches. Intertracheal notch. Pituitary gland, control of endocrine glands, hormonal disorders, scaphoid fossa, upper extremities such as the shoulder, arm, elbow, wrist, hand and fingers, triangular fossa, lower extremities such as the hip, knee, ankle, foot, uterus and pelvic organs, conga, visceral organ disorders, superior conga, abdominal organs such as the spleen, pancreas, kidney and bladder, inferior conga, thoracic organs such as the heart and lungs and also substance abuse, conga ribs, stomach and liver, conga valve, thalamus, brain, sympathetic nerves, vascular circulation, general control of pain, subtracts, laterally problems, auditory nerves, internal nose, throat, internal helix, internal genital organs, kidneys, allergies, posterior ear, motor involvement with body problems such as a muscle spasms and motor paralysis, posterior lobe, motor cortex, extra pyramidal system, limbic system, posterior groove, motor control of muscle spasms of paravertebral muscles, posterior trigal, motor control of leg movement, leg muscle spasms and leg motor weakness. Posterior conga, motor control of internal organs, posterior periphery, motor neurons of spinal cord, motor control of arm and hand movements, auricular zones. In order to provide a systematic method for locating the precise position of a point on the ear, a zone system was developed which uses the proportional subdivision of major anatomical regions of the auricle. A set of two letters and a number represent each ear zone in concurrence with guidelines established by the World Health Organization, Acupuncture Nomenclature Committee, Acupuncture 1991, WHO 1919. This zone system is modified from the auricular zone system first developed in 1983 at the UCLA Pain Management Center, Oleson and Croydon, 1983. A single letter was used to designate each area of the auricular anatomy and a number designed each subdivision of that area. The figure which is shown in the revisions of the auricular nomenclature system originally developed by Oleson were based upon the recommendations of the 1919 WHO Nomenclature Committee. Different zones are referenced with two letters and a number. The projection of numbers goes from bottom to top and from center to periphery. The final WHO General Working Group and Auricular Acupuncture Nomenclature met in Lyon, France, WHO 1990. Auricular diagnosis procedure. Visual observation of skin surface changes. Just as classical acupuncturists have observed distinct changes in the color and shape of the tongue and in the subtitle qualities of the radial pulse, practitioners of ear acupuncture have emphasized the diagnostic value of visually examining the external ear. Though not as routinely observed as other diagnostic indicators of reactive ear points, prominent physical attributes of the auricular skin surface have been associated with specific clinical conditions. This visual inspection of the auricle should be conducted before the ear surface cleaned or manipulated for other auricular procedures. Dark colored spots, shiny red, purple or brown spots at distinct regions on the ear surface usually indicate acute inflammations. Bright red tends to indicate an acute reaction that is painful, whereas dark red is seen with patients who have a long history of disease. Dark gray or dark brown can indicate tissue differentiation or tumors could be found in the corresponding organ. These colored spots are not to be confused with ordinary freckles that do not necessarily indicate a diagnosis condition. If pressure is applied to these colored regions of the auricle, that spot is often painful to touch. Absence of these spots does not indicate the absence of any medical problem, but the occurrence of colored regions on the ear does suggest the high probability of some type of pathology in the corresponding part of the body. These colored spots only gradually go away when the health of the related body area improves. White skin, white flakes, crusty scales, peeling skin, shedding and dandruff-like areas of desquamation always indicate a chronic condition. Whiteness surrounded by redness in the heart region indicates rheumatic heart disease. A close inspection of the ear of many patients indicates that there is a dryness on localized regions of the skin. If the auricle is clean, the white flaky regions will appear within several days unless the corresponding condition is treated. If a treatment is effective for healing a given condition, flaky regions do not reappear. Physical protrusions, specific areas of the auricular skin surface can exhibit spot-like protrusions, slight depressions, rough, thickened skin, or blister-like papules protruding above the surface. The papules are small, circumscribed, solid elevations of skin that could be colored red, white or white papule surrounded by redness. Sometimes there is a dark gray papule. Earlobe decreases. Diagonal folds in the skin over the ear lobe have been correlated with certain types of health disorders. Some double-blind clinical studies showed that the presence of a crease running diagonally from the tragic notch to the bottom of the lobe was more predictive of the occurrence of a coronary problem than either blood pressure level or serum cholesterol level. Acupuncture Allied Therapies, whom 1996-1999 has reported that other earlobe creases are associated with the incidence of cancer. Tactile palpation of auricular tenderness, the most readily available technique for determining the reactivity of auricular reflex points is to apply localized pressure to specific areas of the auricle. Patients are often very surprised that palpation of one area of the external ear is so much more painful than identical pressure applied to a nearby auricular region. Even more amazing is how the specific area of the ear had been previously recognized on ear reflex charts as indicative of pathological problems that the patient is experiencing. General reactivity. Check broad regions of the external ear by using long stroking movements with your fingers and by applying generalized pinching pressure to given regions of the auricle. Determine areas of increased ear sensitivity of the patient to apply palpation with the thumb on the front of the ear and the index finger on the posterior side of the auricular. Specific tenderness. Localized tender areas on the external ear are investigated with a long metal probe with a round, blunt, smooth tip approximately 1.5 millimeter in diameter. Slowly glide the probe over the ear surface, stopping on all small regions that the patient states are sensitivity to lightly applied pressure. The more sensitive the point, the more serious the disorder. Tenderness appears within 12 hours after a health problem occurs, becomes more sensitive if the condition warns, and disappears within 7 days after the problem is corrected. Behavioral monitoring. The practitioner should ask the patient to rate the degree of sensitivity that is felt at each point on the auricular when pressure is applied. The Chinese have developed a similar grading system where the degree of facial grimaces and verbal expressions is rated as follows. Electrical dictation for ear reflex points. Other modern methods which they is followed. Electrical detection of ear reflex points. In this method, the diagnosis is done by examination of the auricle with an electrical point finder, which they claim to be more accurate and easy. Ear points finders are smaller, closer to the surface, and have lower electrodermal skin resistance than do body acupoints. The point finder should be a spring-loaded, constant pressure rod with a small ball at the end. Even more selective are concentric bipolar probes with a small rod in the middle and an outer barrel. Bipolar detecting probes use different amplification of the voltage difference between the two adjacent electrodes. This procedure allows for maximum discrimination of the difference in electrodermal skin resistance between adjacent skin areas. The auricular probe is applied to the ear by the therapist while another lead is held in the patient's hand.